Thank you, Chairman. Thank you, Ranking Member Thompson. Secretary Mullin, you called our complaints about facilities like Delaney Hall a hoax and have stated that detainees receive health care, 3 meals a day, due process. But I will say that from dozens of conversations, like my colleagues Poe and MacGyver, that I have personally had with detainees and what I have witnessed at Delaney Hall and at the Elizabeth Detention Center, I can say that I am horrified about the conditions that I am seeing, that I have witnessed in these facilities. The most shocking, to be honest, is what I would describe as medical abuse. I will say that I met detainees who complained about weaponized poor sanitation, spoiled food, specifically lack of medical care, and as it is related to their medication, a level of abuse that frankly is putting immigrants' lives and detainees' lives at risk. I will share that I interviewed teenagers, pregnant mothers, the elderly, vulnerable people with chronic conditions, and here's what I heard. I met detainees who were given critical medications sporadically: insulin, metformin, diabetes medication, other diabetes medication, high blood pressure medication, cholesterol medication, thyroid medication, hormonal medication, all medication that, if given sporadically, can in fact harm an individual's lives. I met detainees who not only were given their medications sporadically or had their dosages lowered without consultation of their doctors, but I met detainees who were not even made aware of what medication they were given, just handed a bunch of pills and not told what had changed and whether or not any additions had been made. I also met detainees with chronic health conditions that were not being treated at all, or if they were being treated, insufficiently. So, sir, I'm going to make it easy. I would like to ask you a few yes or no questions since we're short on time. Again, questions. So first, do you audit how many detainees have chronic illnesses like diabetes, cancer, heart disease, or any chronic disease? Yes or no?
As I said before, we provide 2 times the medical personnel.
Yes or no,
per
sir,
person
because I'm
than
short
the New
on
Jersey
time.
State Penitentiary does.
So you do audit the.
I didn't say that. I don't know if we audit that specific issue.
Okay, so that's a no. Okay, I'm going to take that as a no. Do you monitor the conditions of detainees as warranted and prescribed by their doctors and not just by ICE employees or contractors? Yes or no?
2 times more medical staff than the state penitentiary does per individual.
Do you monitor the conditions of detainees who have chronic conditions as prescribed by their doctors? Yes or no?
2 times the medical personnel.
Okay, I'm going to take that as a I do not know the answer. Third question, detainees complain of healthcare treatment taking up to a week or more. Do you audit or track how long it takes between complaining about a health condition and the time it takes to receive care? Yes or no?
In the state penitentiary, a 48-hour.
We're not talking about state penitentiaries, sir. You do not oversee. I'm not speaking of state penitentiaries. I'm speaking of Delaney Hall
our
and immigrant
standards
detention
pass
centers.
and succeed your own state penitentiary.
Okay, so as I understand it, yet again, the answer is I don't know. Will you allow New Jersey's Department of Health to conduct full and routine inspections of all areas, including areas that have impact on the health of detainees and staff?
Where they are legally able to go by state statute and the federal contract, we will allow them to enter, which is what we did the other day.
So if the bathrooms pose a health threat, are they allowed to go inspect the bathrooms?
Depends on what's within their contracts and our state agreement that we have with that federal facility.
So I am hearing that it's a yes, that they should, given that detainees.
Where they are legally able to go based on the contract we have with the state.
Okay, so again, I'm going to take that as a I don't know. Will you provide the state with the number of individuals that are detained, the number of seniors, pregnant women, individuals with chronic diseases like diabetes, congestive heart failure, hormonal conditions, cancer, or more?
We are required to report. We will report. By the way, you made a statement about teenagers.
I
being out there.
haven't
We don't
finished.
hire. We
You
don't
can add
hold
in a
youth
moment.
there.
Will you institute a no-tolerance policy for retaliation against any detainee or staffer that is a whistleblower? Is that a no?
Gentlemen, gentlelady's time is now expired.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.